Hi, I'm Colin Hung with Healthcare IT Today. I'm excited to sit down with Niall Brennan, who is the Chief Analytics and Privacy Officer at Clarify Health. He's also the leader of the Clarify Health Institute. Niall, welcome to the program.
Thank you very much. It's great to be here.
Now, you're doing a lot of really interesting work around price transparency. Tell me a little bit more about that.
So many things. Clarify definitely dove headfirst into all the payer and provider data that's come out over the last couple of years. It's almost kind of a homecoming for me, like going back to my days at CMS when we pushed out the very first hospital chargemaster files, and everybody freaked out and thought it was the most incredible thing ever, and yet they were just chargemaster data. They actually weren't the negotiated rates. People for many years thought that it might never be released, and yet here we are. So massive progress, a lot of work, particularly the payer machine readable files. They are, vast beyond belief, many hundreds of terabytes of data, a lot of duplication, a lot of what we call at Clarify Health zombie rates, where they're publishing rate provider combinations that just would never exist in the real world. So spinal surgery rates for a clinical laboratory. So, we've been working really hard at it. Actually, this week we launched a brand new tool that lets people query the data in a totally kind of NoSQL way. You don't need to know how to code. Everything is staged in the background, and it's just incredibly efficient and easy, given how just utterly confusing and overwhelming the data can be. So we're pretty proud of that. We think the engineers did a nice job.
Nice. That's a lot of exciting stuff that's happening with you guys. Tell me a little bit more about the Clarify Health Institute. What's going on there? You recently put out, you normally put out some pretty interesting statistics. Tell me more about that.
Yeah, so that was one of the main reasons I came to Clarify. Well, lots of reasons, really like it, but was the opportunity to use some of the Clarify's data for more public-facing thought leadership work. It's something I've done for many years at CMS and then
Right.
HCCI, and so we're really proud of some of the things that we've put out in the first year of the Institute. We did this fantastic brief tracking pediatric mental health trends.
Okay.
A really, really important issue. Documented a 40% increase in hospital admits for mental health issues, and a 10% increase in ED visits. And we're able to do this on a really large sample size of 25 million kids. And so we're actually going to update and re-release that research in a couple of weeks, and instead of looking from 0 to 18 years old, we'll look from 0 to 21, because mental health is a burden at all ages, but we felt it was good to expand that a little bit. We've done some work looking at the impact of surgical volume on quality, and found that surgeons that provide more surgeries tend to deliver lower cost, higher quality episodes. We've done some work looking at Z codes as a way to use them to perhaps better identify social determinants of health and claims data, which is we've struggled with a lot. And then finally, we've done a lot of work around payer rates. We released our Confronting the Zombie Rate Apocalypse brief a couple of months ago. People really like that, and we're going to have much more analysis coming out there over the next couple of months.
That is a lot of amazing data. Thanks for sharing that. I was going to ask you about the examples, and you provided them right off the bat. That's fantastic. I want to go back to something you said before, though, around price transparency.
Mm-hmm.
What are you hoping to see now over the next 12 months in terms of moving that forward, improving price transparency?
Yeah, so I think there's a couple of things that need to happen. So candidly, some of the data, both the provider data and the payer data, needs to be improved, and we'll be looking to CMS and other folks to help make the overall quality of the data better. It's a huge step forward, but there are still some holes, and if there are still some holes, you can't, tell the full story.
And by data quality, what do you mean by that exactly? Is it that the data is not normalized, or is it that the terminologies?
Exactly. So the data should be normalized. There is a data schema, but for example, on the payer side, some payers are just not reporting NPIs.
Gotcha.
Or another payer is only reporting TINs, or a payer has fantastic inpatient hospital information, but seems to be missing negotiated rates for lots of outpatient CPT codes and things like that. So it's kind of like a little bit of a mosaic, and we need to fill in we need to fill in those gaps on the hospital side. I think hospitals have struggled a lot more with those requirements in general. One could argue that they're not as well set up as payers to deal with it. And, there's certainly been many documented instances of, fairly middling compliance by hospitals. Some people say it's 25%, some people say it's 50%. But the reality is, unless you're getting close to 100%, again, you're sort of defeating the purpose of trying to get this information out in the first place.
Sure. Now, you shared some wonderful information with us. Where can people go to find out more information about Clarify Health and the Clarify Health Institute?
Yeah, we are definitely on the internet. Clarifyhealth.com. Within that site is all the resources related to the Clarify Health Institute and our products. We've got some excellent training and learning and SME videos up there. We've got all the Clarify Health Institute briefs. People can follow me on Twitter at n_Brennan, and I'm always trying to be as responsive I can. So if people want to reach out and have a chat, I would love to do that.
Awesome. Niall, thank you for being on our program today and chatting with me.
Thank you, Colin.
This has been Colin Hunt for Healthcare IT Today. Thanks for listening and watching.